Well, with coronavirus cases rising across the country, especially in the Carolinas, health experts are pleading with the public to follow safety guidelines. Here to talk with us about those guidelines and how hospitals are currently dealing with the increased caseload is Dr. Marcus Blackstone, who serves as Chief Clinical Officer at Bon Secours Health Systems. Doctor, thanks for joining us this morning.
Good morning.
Now, my first question, we know that those COVID-19 cases have been going up, and leaders from the federal and state level say that people 21 to 30 are seeing the most of the infections right now. What are you seeing at the hospitals?
So in the hospital, we're still seeing the older, more vulnerable population that the younger folks are exposing. But now we're starting to see some of the younger population that is getting admitted to the hospital.
And that's really important to note because we've been discussing about the more vulnerable population, and folks that are falling in that age range of 20 to 30 might not think that they'd be hospitalized from it. Now, we know symptoms for COVID-19 have changed since the beginning of the pandemic. If someone comes to see you and they're sick, what are some of the factors that you consider before you go ahead and administer a COVID-19 test?
So, when we started, a lot of this was mainly respiratory symptoms, a cough, shortness of breath. But as we moved on, we started noticing you see that, but you also see muscle aches, fatigue, loss of smell and taste, along with, some GI symptoms, the diarrhea, the nausea. So, that's, as we've gone on, it's multiple symptoms, but the biggest thing we ask about is potential exposures as well, and we put that with the symptoms.
Yeah, and that's really important for folks to kind of pay close attention to their interactions on a daily basis in case they start to get a feeling of some of those symptoms they might know, and they can trace back to where they got it from. Now, can people who have had COVID-19 once get sick again?
So we don't know the answer to that yet. We don't know if they get sick again, whether it's a reactivation of their initial infection, or whether they could clear it, get better, and get reinfected. That's actually an unknown at this point.
All right, certainly something to still pay close attention to. Now, we know there's been a lot of criticism over these right here, the face masks and the policies. Why is wearing a face mask so important, and can it hurt you in any way? That's a question some folks had.
So I'll start with the harm part. A mask is not going to harm anybody. Remember, we wear these in healthcare all day long. So there's no harm in wearing a mask. I mean, remember with young kids, there are recommendations from the CDC about how young, for kids to wear them. And it's more about properly wearing the mask, but there's no harm. But here's the big thing about the mask. It's a dual protection. So if you were to have COVID-19, even if you don't have symptoms, it's droplets. So it's cough, it's sneeze, it's talking out loud, it's singing. People don't think about those activities when your mouth's open, that you can get droplets out of your mouth and your nose. So when you wear a mask, that's what protects other people. But the other part of wearing a mask is if you're around people who don't have a mask and they're talking to you, it's the same thing. And so we know that if two people are standing even closer than they should at 6 feet and they both have a mask on, the chance of infection goes down significantly. So literally, the mask, and they're not comfortable, but they are, one of the single factors. That and social distancing makes a huge difference.
Absolutely, and we do hope that folks really kind of listen to those words that you've just mentioned and take that seriously as we head into the 4th of July weekend. We know a lot of folks will be celebrating, and hopefully they do so safely. Doctor, thank you so much.